Hello everyone, my name is Madeline Sands, and today we're going to be talking about menstruation. So it may be an uncomfortable topic to talk about, but I promise it's very normal, and it's really not as scary once we start talking about it. So hopefully after we talk about it today, if you've already started it, you will have learned something new, and if you haven't, then you'll be more prepared for it when it does happen. So first of all, I just want to say that it's very normal. It happens to every female, and it usually does start when you enter puberty. So on average, it kind of happens to females at the age of 12, but there is very much a variation. So some people start a little younger and some people start a little older. So if you did before or you will before or after, that's completely normal. So the menstruation cycle starts on the first day that a female starts what's called a period. And so a period is just about 4 to 7-ish days, about a week long, where there is vaginal bleeding. So we're going to talk about that and get you feeling more prepared for it, because it's really not as scary as it sounds. So before we get into more of like biologically what your body's doing, we're going to talk about 2 items that will be very useful for you. So first is a pad, and the other one is a tampon. So I'm going to talk about the pad first, and again, this is what it looks like, usually like a bright colored packaging. And then how you'll use it is you'll just open it up. When you open it up, it's kind of like this big long, it almost kind of looks like a diaper, but it is used to catch the blood that comes out of your vagina during your period. And so you'll take it off of this paper. Some of them have what's called wings and some of them don't. So if you don't have any wings on them, they just sit in the bottom of your underwear. And again, they just catch the blood. And if you do have the wings, this comes off and then the wings kind of go and hug around your underwear, kind of a little more sturdy. So if you use a pad, it's recommended to replace it every 4 to 6 hours. And then if your bleeding's a little bit heavier, like sometimes girls have heavier bleeding towards the beginning of their period, you need to change it every 2 to 3 hours. So, secondly, there's a tampon. And for this one, I do have a diagram. They should be here. So we'll look at it together. So, you have your tampon. Looks like this. Usually, again, kind of a colored packaging. And when you use it, you'll just rip it open. Some are simpler, but I have the one with the push tube. So you're gonna have it here. You're gonna make sure your string is down, and then you'll gently insert it into your vagina. It's a little bit more invasive. And then once it's in your vagina, you're gonna push this, and it'll the actual tampon will pop out. And so this will be inside your vagina, and then this will come out. You'll throw this piece away, and then you'll just make sure that this piece is out. It'll just kind of lay in your underwear. So then, again, 4 to 6 hours later, when you need to take it out, you'll gently pull on the string and it'll come out, and you'll just throw this away. So yeah, again, the tampon also is used to catch the blood that comes out. And again, 4 to 6 hours, you're gonna remove it with the string. So during menstruation and just throughout kind of the whole month, a lot is going on in your body. So it's really important that you kind of take care of yourself. You're drinking your water, you're eating, just all the things. So now I'm gonna go over kind of what's actually happening in your body and kind of the whole month cycle. Just kind of in simple terms, just so you know what is going on. So I have another diagram for that, so we're gonna look at that. I think it's a really good one. So when you're on your period, like we've talked about, you're in the menstruation phase. So again, you're on your period, and inside of your vagina is the uterus, and so during your period, the lining is kind of shedding. So when you do start your period, it might be kind of thick or have like kind of little chunkies in there, but that's literally just the lining shedding out. That's simply what it is. And so you have 2 kind of female hormones that are really important. You have estrogen and progesterone, and during your period, these are low. So throughout the month, they kind of go up and down, depending on what's going on in your body. So that is the menstruation phase. Then you have the proliferative phase. So this is after your period, and this is when that female hormone, estrogen, kind of rises back up. And then also that uterine lining that kind of was like shedding during our period, that is now getting built back up. Okay, so then moving on, you'll go to your ovulation phase. And that is when in your vagina you have ovaries that hold the eggs. And eggs are what can, if fertilized, will get you pregnant. And so we know that, the anatomy, all the things. So during this phase, an egg is released. So usually during ovulation, an egg is released. And if it was to get fertilized, you would get pregnant. But in this case, we're not. We're just talking about our normal cycle. So that egg is released. And then again, that estrogen hormone is already risen. So then you'll go to the luteal phase, and this would be kind of where your body prepares for a possible pregnancy, but you know, you're not pregnant. So it just gets ready again for your period to happen again. And then that second hormone, the progesterone, is rising back up. So now estrogen and progesterone are risen back up to kind of more of a normal level. And then again, you're right back around to the menstruation phase. You're back on your period. Those hormones are back down, the uterus lining is shedding, and so yeah, so that's kind of what's going on in your body. That's why there's a lot of changes, different things again. So throughout the month there is a lot going on, even when you're not on your period. So lastly, I just want to emphasize really how important it is to take care of your body. Like the whole time we're talking about your body's doing so much all the time. Hormones are rising, lowering, all the things. So especially during your period, there can be kind of some not so fun symptoms that can happen. People experience some cramping, maybe in their lower back or kind of down where their uterus is at, like below their stomach. There could be some bloating in your stomach, whether you've eaten or not, you can experience that. Maybe some acne flare-ups, maybe some headaches, and even some like certain food cravings. And all of that is completely normal. A lot of women experience these symptoms. And sometimes they're way extreme, really painful, all the things. Sometimes you may have just a little here and there, and then some people may not experience them at all. So if you do have them, it's okay, and if you don't, that is okay too. So lastly, I just want to, again, emphasize it's really important to take care of your body, drinking your water, eating, and then if your cramps or different symptoms are really, really bad, and they're altering like how you're like you feel like you can't focus in school or you can't go to work and different things. If it's not too bad, I would take pain medicine and safely. But if it's really, really affecting going to school, going to work, all those things, and you just kind of listen to your body and you're like, something doesn't feel right, you should go seek a doctor because they can help you and make sure that everything is good and how it's supposed to be. So I hope that you learned something, or that you feel better prepared for when puberty does hit. Thank you.